So this is your hip mobilization video. It is an entry-level video, so don't do this with the intention of trying to improve flexibility. All you're trying to do is just get gentle motion and encourage that adjustment change that we are trying to make. So the first exercise, let's say you're trying to mobilize your right hip. We're going to lie on our side. Good to do on the floor. We're doing it on the table. And what you're going to do here is called a clam shell. And the clam shell is a movement that's going to happen primarily in the hip, where we're going to lift our knee up slightly, abduct it, which means going from here to here, and then we're going to externally rotate the hip, so my hip is turning this way, the hip joint like that, and internally rotate. And we're just going to repeat this over and over. If you're having pain through this, just either veer away from the pain, the spot. So if you have pain here, just stop right there and bring it back. And the more you do, actually, the more range of motion you'll get naturally by hydrolyzing that joint through movement. So we're going to do this, and right now I can feel my little intrinsic external rotator muscles in the butt area, but for my hip joint, they're actually starting to fatigue. It's a really good workout. So again, it's an exercise, not a stretch. It's a mobilization, not a stretch. Don't worry about range of motion. It will increase naturally as the joint plumps up. So you do about 15, 20 reps. You can do 20, 25 reps even, but just take your time with it. Then once you've done that, you've got these muscles right here warmed up. You've got the joint moving better, and we're gonna work on some balance. And this is again an exercise of stability. You're not searching for flexibility. You're not trying to do a stretch, even though you can easily turn this into a stretch. So be careful on this. You're gonna grab something for balance. If you don't have a hip problem, most people can do this without grabbing something from balance, but a lot of balance that your body relies on, it comes from the hip joints. So if you have problems, this could be an issue. So hold on to something, but you're going to take a very small step forward so that my heel right now is on the ground. And from this position, I'm going to neutralize my hips. I'm going to make sure that they're not twisted, but that they're nice and neutral. Big mistake is to typically twist or to let that glute medius just relax right here. So you want to hold that in and square up those hips, and you're going to squeeze the quad muscles. These muscles really tight, and you're going to push your heel really hard into the ground. You're going to feel a little traction on the hip. That's it. And you're just going to squeeze your butt muscles, squeeze your quad muscles, and you're going to hinge your back, your spine slightly backwards. And a more advanced version of this is, if you're like, this is easy, I feel a little traction here. Remember, not a stretch. We're trying to get into that joint, stabilizing it by squeezing our butt and squeezing our quads, and then leaning back ever so slightly. We're going to take a bigger step, and this is more advanced, but way more effective version, where now, look, my heel is off the ground, and now I have a lot of traction on the fascia, not the muscles, but the fascia that connects my whole hip to my ankle. And we're just going to do little tilts here, where I press my heel up into the air and relax. And remember, squeezing here, pulling here, but tilting up and down, pressing the heel and relaxing. And you might do 10 to 15 of those. And you know what? If whatever you do on your bad side, do the exact same thing on the good side, because we want to get this healthier and we want to keep this side healthy for good balance. Remember, it's all about balance and stability. Enjoy.